So this is the Board of Health meeting of, what's this, April 5th? And the whole board is here. I read the memo that went out about the open meeting law, and we're supposed to say everyone who's here. So I'm here, Catherine Hilton, Arlene Reed, Noreen Pease, Wim Levine, and Garrett Simonson. That's the Board of Health, and our health agent, Claudia, whose last name escapes me right now, I'm sorry, Claudia Sarti, is also with us. So, because your name says Claudia S. Irving, which is a very nice name, probably not yours.
No.
Right. So, quickly, did I send out the draft minutes of last meeting?
Yes, I
Oh,
believe
good.
you did previously.
Yeah, like right after the day or two after the meeting. Can we approve them? Is there anything missing or wrong with them? Well, two of you weren't even here, right? So
Right.
it's Wim and Garrett. Are you guys okay with the minutes?
They were fine.
I'll move to approve.
Okay.
Second,
Okay. All in favor? Right.
Yes.
Aye.
Okay.
Very yes.
Arlene, yes.
Right. And let's just do for the minutes. Thank you. I have two things to talk about, and I know that Noreen and Arlene have things, and Garrett, they all have things to tell us. At some point, we're going to have to give a permit. We probably talked about this. We're going to have to give a permit for Tim Hunting to remove the beaver dam that's in the culvert under Lakeview Road at Fisk Brook. Apparently, that is a 10-day permit, so we shouldn't give it until Tim is ready and has all the other requirements fulfilled. But then we want to act fast. So what I would like you guys to do is vote to authorize me to give that removal permit when the time comes.
I move that we authorize to give a beaver removal permit with a 10-day duration within that window when it is required.
It's not removing the beavers per se, it's removing the dam.
Oh, okay, amended.
Second,
So it looks like Garrett has
Yeah, I do
Oh.
have a question about that, because I thought my understanding was that for removal, it also has to go to Conservation Commission.
it does, but we both have to give permits. Both the Board of Health and Conservation, and there's quite a few hoops to be jumped through. But that's our part, or at least part of our part.
So basically, if we vote to approve that, then that's what triggers it going to Conservation Commission, right? In terms of the order of process, because my understanding is that we initiate any emergency permit.
Right, and I'm not sure it's going to be considered an emergency even, but we were advised actually by Conservation to not give the permit until Tim's ready to pull the trigger, so to speak. Any other discussion?
I don't think we've seconded the motion. I'll second the motion.
Let's do it this way. Is there anybody not in favor? Okay, hearing no objection, I'll consider it passed. I've mentioned this before, maybe not with Noreen and Arlene. There's somebody in town who's just bought here, owns the place, has to replace the septic system. I think bought it in a failed state and has to do a fairly expensive repair. It's over on Merrill Drive by the lake. And this person is interested in getting a betterment loan. And with a little creative accounting, we are actually able to offer that loan by breaking into a budget line that was for, maybe Arlene might remember this, there was another septic system repair program before the one, and we gave one loan. There's a bunch of money in that account, been sitting there for like 20 years. And I asked the town accountant if we could use that for a similar purpose and lend it out as if it came from the Water Pollution Abatement Trust. And she said she was quite willing to do that as long as we stayed within the purpose. So there's a bunch of, that guy just got back to me today, so I don't have remember there's all these findings we have to make that the system has failed and blah, blah, blah. So I don't have all that ready for us to vote on. He'll just have to wait till the next meeting, but that's something coming up.
Okay. I don't remember the particulars of the fund that you're talking about, and I don't remember the particulars of the findings we need to make. It's been a long time since we provided a betterment loan. My goodness.
It is. It's a really long time because we charge 5%, and for a while the rates went below that, so nobody was interested.
Right.
The findings we have to make, we have to find that the system is failed.
Mm-hmm.
And we have to find that the person has applied for a loan and has sought bids for the repair.
Mm-hmm.
And that I think that we also have to find that they're not delinquent in their taxes.
Okay. Is there a minimum number of bids they must have in hand?
Three is recommended, but in the past, what's happened is that people haven't always been able to get 3 bids. So what they do is they submit the name of the people they asked for bids who didn't give them.
Yeah.
So I know this guy got 1 bid, and that's how this came up, because he was alarmed at how high it was, and I gave him some more names that he could try to get more bids. So presumably he will have 2 or 3 at least.
Okay.
Do you recall if there is a guarantor for these loans, or what is the liability if the borrower defaults?
If the borrower defaults, when they take out these loans, a notice of betterment agreement is recorded at the Registry of Deeds. And if the borrower defaults, it's automatically converted into a lien on the house, and the town has the first claim on the proceeds from the sale of the house.
Got it.
We've never encountered that situation, though, have we, Kat?
We never have.
It's always a first time.
I hope not.
Well,
But
I hope not too.
Mm.
So that is something that I guess we'll have to do at the next meeting,
Okay.
assuming that that's the way this guy wants to go. So that's it for me. Now, everybody else has lots of things to report, I believe. Oh, wait, before I give it up, I'll just summarize something that Arlene and I have been dealing with, and that's the mosquito control district, which is completely screwed up. We paid for the first year, and we got reports from the first year, and after that, just everything went to hell. And the person who was basically was the mosquito control district has just left the position, and apparently left it in some disarray. So we're going to try to get it back on track. Long story short, and it's a really long story that you really don't want to hear. So over to you guys. Garrett, did you have a meeting last night?
last night. Oh, there was a Valley Health collaborative meeting that was focused on the state assessment. But the parts that I've been working on related to the settlement funds and the agreement for Valley Health, I wonder if we want to wait until they join us to talk about those items.
Okay,
Since
you were working
relates-
on the opioid settlement.
And then the agreement to
Oh, the intermunicipal agreement.
yep.
Just a question, Garrett, do you want to wait till they come to talk about the capacity assessment review and at least bring the board up to date? We could at least give them background as to what was happening.
Yeah, I
if the
think
board
That would
is
be good
willing.
because I don't know anything about it.
Well, Garrett and I both attended the meeting yesterday, and it was basically the state staff who has done the data collection, set up the whole system to which we responded. And they were reporting out data specific to the 6 towns in our public health excellence grant community. And so we have lots of baseline data, which was just based on not on our performance, but just what our capacity is. And they really emphasize that as this is baseline, looking at where we are now in the hope that with this grant money that we're getting through the cooperative, that we will be improving all of these objectives significantly over time. The other purpose of looking at this data at this point is to begin to develop a work plan for the upcoming fiscal year. And there's a meeting in the process of being scheduled right now for the collaborative to work on a work plan and a budget for the upcoming fiscal year. And some of the areas where we had, let's say, lower capacity scores would be areas that we would look at in terms of trying to build our capacity in the upcoming year. And we'll be getting some more information too within the next couple of weeks as to whether we would be, right now our grant is level funded, but there's a possibility if we choose areas that the state is interested in us pursuing to improve our data and our capability, that we could get extra dollars in those areas. And perhaps Jen can speak to that a little bit more cogently than I am at the moment. There's also, there's going to be a dashboard that we can look at for this particular data, and there's going to be some training on how to use the dashboard. So I would encourage anyone who might be interested in learning more about how our data turned out or what we look like in our region, and our region compared to the state, which is what we sort of got in terms of background information yesterday, that you might want to take this online training for how to use the dashboard and the software that will give us a better sense of how we're doing.
Mhm.
Derek, you may have some other things you want to mention as well.
I think you summarized it well. One of the things that that I thought was complimentary that the folks from the state pointed out in that meeting was that this collaborative is one of the more recent ones to come online, and their impression was that as a group of communities that we're already heading in the right direction to tackle a number of the things that were highlighted in the assessment.
I should add, because we're supposed to name everybody who comes to a meeting, that we have been joined by Jen Hoffman and Megan Tudrin. And that's it.
Let me just add who they are in case not everyone on the board is aware. Jen is the director of public health for Greenfield, and Megan is her chief nurse. I don't have her exact title, director of nursing for Greenfield, I believe. And I think Athena, who is the grants manager, will be joining us. And I think we're due to talk about this at 7:30. Correct, Kat?
That's correct. So we still have we still have a few minutes to go.
Did you want to mention the annual meeting opportunity, Kat, on June 3rd? I know it's also our town meeting, which is tough for most of us.
Yeah, I wouldn't go, but there is a training from MAHB on June 3rd in Holyoke. It's the only one that's close to us. The next there are three. The next closest one is in Marlborough, which is about an hour and a quarter from here, I understand. MAHB trainings are really good, especially if you're new to a Board of Health. But there's a serious conflict there. If anybody's interested, I'll send you the registration. And in fact, I'll send that around anyway, just for your information.
I think the other thing, Kat, we could update the board on is that the cooperative is in the process of interviewing nurses, and I couldn't make the meeting on Tuesday, so Arlene went to that meeting, and she may have some updates on how that's going, and Jen may want to update us a little bit as well. And just to inform the board, there's a second interview tomorrow for the nurse, and Arlene and I were just discussing whether it made more sense if Arlene's available to go to that second interview, since she participated in the first and would then have insight into both candidates and could give Jen and Megan some better feedback.
Sure.
That's cool. Noreen, you and I talked about possibly inviting somebody from Council on Aging tonight, but I didn't do that just because I didn't. But it would be good if some one of us would make contact with one of our Council on Aging people and try to get a sense of what they think some of our needs might be for a public health nurse.
Exactly my thoughts, Kat. That an up-to-date needs assessment is something we do not have right at our fingertips. We did it's probably 10 years ago now, that we did a survey to find out about ease, the level of ease people felt about finding a provider, getting to their provider, all sorts of access kinds of questions, but all of that would be outdated now. And
how do you think that kind of data would best be collected?
I would love to defer to someone maybe who's got experience in collecting that data from a community.
Jen seems to have an idea. Let's have it. Go ahead.
Well, good evening, everybody, and I'm honored to be here and meet all of you. I met some of you already, but one of the ways, there's several ways, there's a lot of databases that we have access to. One is the census. There's other local information sites. Basically, the Alzheimer's Foundation has good focal zones. Councils on Aging, they have nationwide information. I could look up disease profiles from certain organizations. And we also just have those epidemiological sites that we can look at and focus on each town on race, gender, age, any type of mental health disorders that they just collect. So I could get a lot of that information. Whomever the nurse is that is chosen, I will give the basic census information and whatever I can find on your town. And then they can take that, meet with your Council on Aging, meet with all of you, discuss what's found by the statistics, and have the big eye view. And then you guys can narrow down to what is interesting to your community and your board. But it's very exciting. And if there's certain things that you want me to really focus in on, such as access, transportation, poverty, housing, all the big points. Just let me know, shoot me an email, and I'd be more than happy to get that data for you. And all the data I do, I will bring back to you,
Mhm.
so you have it for your records.
Another potentially great source of information would be our police chief, Kristen Burgess.
Hope she's going to come tonight.
She's, yeah, I thought she was
got
going
an
to, yeah,
invite.
yeah. She may have, just from her need to enter homes for various purposes, she may have a great sense about what's out there too.
I think of her as the town social worker.
Yeah.
Go ahead, Jen. You don't have to raise your hand. Just speak up when you want to.
And also, I think I'm going to be speaking a lot to Claudia, because she has access
Mhm.
into different ways in towns. And even if she's doing a Title V or whatever it is,
Mhm.
she can see areas where there may be needs. Having a
Right.
close relationship with the nurse, having a close relationship with the inspectors is
Mhm.
huge. And
Mhm.
it would be helpful for Claudia when she's like, I have no idea what to do. And having someone there on site that could give direction and help and resources, so it's not fully overwhelming. So having a public health nurse is a huge resource and a huge advocate for things that affect people's lifestyles and their health. So yeah, so Claudia, you'll be hearing from the nurse a lot, myself, so I look forward to that relationship.
Great, absolutely, same.
And Jen, could you just update us on a couple more things? I have spoken to Kat, but the whole board, I don't think, knows that we will be in the process of looking for an office for the nurse. Or Megan, you too, if you would chime in. I know she needs a phone, but other things that we should look for in terms of an office, and it's a tough find here in Shutesbury like it is in other towns. So if you could speak to that. If you could speak to, I think we were talking about she may be starting around June 1st. And how many hours per week? I can't remember. I think possibly 10. Could you just update us on those facts too, please?
Can I add to that list the vaccine refrigerator question?
Yes.
Thanks.
Megan, are you or me?
I can do it. So for an office space, the best thing would be a place where there's access to a bathroom, so that if she was to give an immunization, she could go wash her hands afterwards. So it could be in a town hall, it could be in a police department, it could be in the fire station. It really could be anywhere that she has a place where she can close the door, and that she could see patients and, check blood pressures and things like that. Doesn't have to be a big space, just something that's private that has access to a bathroom. And the supplies she needs is pretty minimal. Most of the things we're buying with the grant, but we won't buy things like a printer or stapler, like the things that you said. But we have already purchased what we call jump bags, so that if she was to do a vaccine clinic, she would have the basic airway supplies if there was an allergic reaction, dressing supplies, blood pressure cuffs, stethoscopes, all of those things the collaborative has already purchased. Will also come with things like EpiPens and things like that.
And the vaccine refrigerator?
Oh, the vaccine refrigerator, I can't remember if your town was one that had one, but we're looking to put a small vaccine refrigerator in each town if they don't already have one. So that if we hold a vaccine clinic in Lever or Shutesbury, we don't have to worry about coolers and things like that, because they don't keep them at good temperatures for very long. We'd rather have something that we have a digital data logger and we can really watch those temperatures well. So that would be the best thing. And that's something that the PHE can purchase as well. It just has to have a backup power supply.
So Megan and Jen, we do have a refrigerator we share with Leverett. However, it is housed in Leverett, so it might be a good idea for us to have one in Shutesbury. Again, if we can find a place to house it in Shutesbury. So, and one other question: how many hours per week are we anticipating the nurse will be?
It could be depending on what you need. My daughter's just gonna walk by, so I'm gonna close my phone for a minute. It really depends on what you need. The nurse can be hired for up to 20 hours per week. So if she wants to do a big project in your town, she could do 20 hours one week and then none the next, or she could do 2 5-hour shifts. It really is whatever your town needs that fits with her schedule as well. But 20 hours a week would be her, between Lever and Shutesbury.
Jen, you've been trying to talk for a few
Oh,
minutes there.
sorry.
I just wanted to say that, as for like a computer, we will provide a laptop. If there's a printer that she could print out at your site, that's great. We will also be providing a cell phone. And anyone that goes to a conference from the board, if you do not have an academic fund or an educational fund on your budget, we can pay for that conference for you, because it's promoting education for the board. And that's something we need to promote. So it's, when people
So
say,
that
I
would
don't
be
have public health-"
conferences and trainings and things like that.
Correct. I don't know about hotels and stuff like that, so you might not be able to stay at the Carlton or the Ritz. I mean, the Ritz Carlton, but it will pay for the fees for the academic sessions and trainings
For the-
that you
for the
guys need.
registration, yeah.
Yep. So, so basically, you would pay for it, send me it, I get it reimbursed, you'll receive a check. It's easy as that. I don't know if your town has IT services. I worked out a deal with our IT department, that they will provide service, like to help with the software we purchase, any type of communication to the cloud, to wherever, it'll be all hooked up and taken care of. So I just wanted to know that. So there would be no fee for the phone, no fee for any computer that we purchase. The software, there would be no fee. Any education, there will be no fee. It's basically us just saying, hey, what do you need and what can we do and how do we make it happen? So we've already made strides, and we've been making strides. We're already ahead of the game, as we found out with certain things, and I already am aware of the gaps that we all face. So I've been kind of pushing ahead, so it'll be easier to do that workflow. So that's basically the overview. I just wanted to answer those questions and to just let you know about funding and what's getting paid by what.
I should say for the record that we have now been joined by Athena Bradley and by Leonard Sherlocka, who is our fire chief. Welcome. I can't actually see you, Lenny, but I can tell you're there. You're all dark.
I'm here.
Great. Thanks for coming.
Yep.
And welcome, Athena. Athena is our grants manager for the grant. As you can probably tell, Megan and Jen, I've tried to keep this board up to speed as to what's going on with the grant. And we were wondering, again, I'll just tick off a number of things. If we could talk about just update the board on where we are with the IMA. They're aware of it, but maybe we could just tell them what the status is. I think we want to talk a little bit about the opioid plans, and I know Garrett's going to chime in on that. We talked about the nurse and maybe a little update, which you may or may not want to stay on for, about MAFCO. So those are the things I had on my list, and you may have others. I mean, feel free. I think this board, and they can certainly speak up, and I know they will, has background as to what we're doing and why we're involved with this project and how it's going.
Well, I can start on the IMA. And so right now, the draft IMA has been developed, and it's in right now. Our Greenfield attorney reviewed it with me. We had about a 2-hour meeting over it. She's then been reviewing it, and then she met with Mike Hugo and Richard Mucci, the attorney for the MAHB. And so it is in Richard's hand. He's going to make a few changes, and then he's going to send it back to Rose, the Greenfield attorney, who's going to then forward it on to me. And hopefully that's going to happen before our April meeting so that we can talk about it. I'll send it out to you guys as soon as I get it. It'll be redlined, so it'll be the draft that you all have, but it'll be redlined with what Rose's and Richard's and Mike's suggestions are for changes. And then you can compare those. We'll talk about it at our meeting in April, hopefully. And then you guys can take it back to your Board of Health for review and your attorneys and all of that. And I'll give you contacts for Rose so that you can talk with your attorneys, can talk, and they can also talk with Richard. Hopefully too, Richard Mucci and possibly Mike again will be at our April meeting. That's the plan anyway. Yes, Arlene.
You're muted, Arlene.
You're muted.
So sorry. IMA, does it stand for intermunicipal agreement or something?
Oh, I'm sorry. Yes, ma'am.
Okay, thank you.
And the Massachusetts Public Health Association is who Mr. Hugo, is from?
Yeah, Mike Hugo and
Yeah.
Richard Mucci. Richard Mucci's their attorney. They're great. Rose had a very good session with them. Their interest is in making sure that the agreement works for all the partner towns, and it protects Greenfield as the host, but also protects all of you. And it's everybody's interest is involved. And then you all will talk with your attorneys. Your attorneys can also talk with Rose and also Richard Mucci if they have any other outlying questions. Yep. Any other questions on the IMA? And our goal is to get it in because as soon as possible, because our nurses staff can't really start at the towns until the IMA is in place, just for liability issues. And we want to make sure all of that's covered.
And Athena or Jen, anybody, just remind us that goes to our select board for signature and to our Board of Health chair. They
Yes.
both must sign it, correct?
Yes, yes. But again, I would recommend that you run it by your town attorneys.
Yes.
Absolutely.
I also wanted to point out that we're pretty much at that, I'd say, mid to end range of where that IMA needs to be done. That is one of the things we have to have done for our plan in the gap, which we're already
Yep.
almost done with that.
We're
So-
well ahead of the game compared to the other people in our phase.
So if you would like, I could address the opioid situation, if anyone would like that. So
Great.
as you know, we all got a lot of money from the lawsuit that went around, and it's supposed to give this money. The money that we're getting is supposed to go for efforts with the opioid problems that are in all of our communities at different levels. I know that there's some discussion happening in Greenfield, and I'll know more soon. But the mayor is very well aware of what our plans are. She's very well aware that we are wanting to work with our collaboration. We all have great ideas, and what I'm doing is writing a report right now in my spare time to the mayor about what our ideas are and what we are planning to do and costs for that, and showing how we can work with other agencies such as fire and police with these dollars, in addition to what we're going to be doing in general with that money, and that we want to start our initiatives as we discussed in other meetings.
Jen, could I interrupt you for just a moment to
You can interrupt me anytime.
Thank you. To tell you that Lenny, who is our fire chief, is not really we haven't really spoken with him about the whole collaborative, and he might need some a little backing and filling there.
Okay, so I'll give the quickest summary I can give. So the collaborative is a group of 6 towns. It's Greenfield, Shutesbury, Leverett, Deerfield, Sunderland, and maybe that's
Montague.
it. Montague, thank you. And we're all working together. We have a lot of money that we're given. And basically the idea of this collaborative from the Public Health Excellence Grant is to make the standard of public health deliverables equal across the Commonwealth. When we had this meeting yesterday, we learned that even if they gave us the maximum amount of grant dollars, we would still be behind a majority of Massachusetts. That's how low funded our region is. So we have a lot of work to do, and we've been doing a lot of work with what we have. What I do know in my experience so far working with the municipal government is in public health, we really rely on our first responders, specifically fire and then police. You usually go into a situation and then we follow up, meaning you, the fire chief or the fire department, and we have to have good dialogue. We might call you to a situation because we need your help. On that note, with the opioid dollars, that would help us with training and providing supplies that may be needed to help people in crisis. We could do a lot of different things with these dollars. It's just what each town kind of wants to do and what we all want to do together. But the goal is to basically keep people safe in every way, and they're giving us funding to do so. The grant is guaranteed till June 30th, and then I am pretty certain we're going to be getting funded from there on out. There will be additional dollars from other grants that they are going to point us to that might be helpful for us. The opioid dollars are just separate. They're not part of this grant at all. They're just a separate money that all our towns got. So is that a good summary? Or did I leave things out?
Go ahead, Larry.
Yes. Would that include training or just Narcan?
We could have, Megan, you could help with this too. What type of training?
Basically, just administering Narcan and what to do.
Yes, yes.
So that would probably be more expensive, honest. The Narcan is relatively cheap compared to training the whole department.
Well, our nurse is already did a training on how to train people, and all the nurses that we have in our other collaboration with the COVID contact tracing grant. So Megan, you could go on talking about that.
Hi. So we actually can get free Narcan through the state. Greenfield gets, I don't know, our last order was like 75 boxes, and they said that they will give us as much as we need. So that will be covered. And the same thing with training. The nurses, I will train all of the nurses to train other people. And so they'll be able to do whatever training you need at the fire department or for community members. We're planning on holding one in Greenfield soon where we can train anyone that wants to come.
Yeah, Franklin County also offers free trainings regularly.
Yeah. Well, just be actually, we get paid for, the firefighters get paid for training. So if it's a training night, that would be 10, 11 firefighters per the evening.
Great.
So I was just wondering if that would include, if that would actually cover the training budget.
Oh, I would doubt that it covers, Jen, you
could
go
could
for
say more, but I
staff.
highly doubt it would.
I could look
cover-
into that because it's that could be a limitation of staffing and time, and it might be covered. Let me find out, and then also I would need you to email me and kind of have an idea about how much that would cost. So when I speak to the state, but I'll ask because that's a gap where you need to people need to get paid and people need to get trained. How do we make that work?
Yeah.
And
How
I
long
could
is the
advocate.
training, Megan? It's not that long, is it?
Oh, no, 15 minutes.
Well, that's what I thought. Yeah.
But I think, I don't know if it's like
Yes.
this, but like in our fire department and police department, they get paid a minimum set of hours. If they're there for 2 minutes or they're there, whatever, they get a set fee. I don't know if it's like that in Shutesbury.
Yeah, if we
Yeah.
go somewhere, I mean, if we leave our station to go to, say, like Montague or Greenfield for training, we would be paying from leaving Shutesbury Station to Greenfield, for example.
Well, how about if we bring the training to you?
Yeah,
Station? when you're
Yeah, that'll
already
be fine.
working?
Yeah,
Could you do then like a half an hour training and only charge for a half an hour for your group?
we could. That doesn't sound like very much of a training night if it's just for half an hour, but we could do that.
But that's all the Narcan training takes, though. She literally taught me
Yeah.
how to do it in 5 minutes. Megan
Yeah,
did.
I know. Yeah, I mean, there's theory behind everything, and also including CPR and all. So,
Yep.
So it's not just spraying in the nose and don't do anything,
Right.
because it does really have to get into. Um, yeah, so I was just curious because the Narcan is relatively cheap compared to, training for the night. So that's that was just my question.
So if you
Great.
don't mind emailing me what I asked for and I could inquire, that would be the best thing for me. And the more information I have to provide the state, the better I can give you an answer.
Okay.
Did you say you need CPR training?
No, we don't, but in my mind, if that's you're kind of doing CPR if you're doing Narcan, unless they wake up right away.
Exactly. Okay,
So
I'll look into that too.
Yeah, maybe we can do a combined training and do it in Shutesbury. So, yep.
Noreen or Kat, can you please provide the fire chief with my email, so he can get me that information, please?
Sure.
Thank you.
And as
Any
it,
other questions on training, Chief? Any other ideas that you need that you can maybe relay to us in your email? Feel free to do so or talk about it now.
okay, that's kind of all that comes to mind.
Okay.
and as it relates to the settlement funds, the select board did vote to have the town administrator submit application for the new settlement.
Excellent. I mean, I don't want to say yay until I get the mayor's blessing. I'm pretty sure it's going that way. I feel confident, but I just want to hear yes, right? I don't want to say yes and then it's so I just I feel good about it. I don't want to say something and then.
And when I spoke to the select board, I indicated that the board really felt that it would be important for us to take the approach of working with these funds
100%.
through the collaborative.
Everyone feels that way. And that's why I feel very strongly this is it's gonna be fine. I think that it's dollars that are public health dollars and it's for epidemic in our communities that is quite significant and it affects all age groups. And I think that it's gonna be fine. So I didn't want to say, I did not get the mayor's signature. That's all it's about. And there's
Would
just,
it be premature to say if these funds are pooled for the opioid settlement, what are some of the other ideas other than Narcan that you would propose?
so I have a couple of
There's a whole list in the exhibit and a lot of it's around prevention and intervention. And that's what we would like to focus on for public health.
and Megan could give you some ideas too. One of the things we're doing in Greenfield, which is related but not, is that we are now having lock boxes for people to keep, marijuana and gummies locked away so children don't get access to it. That's just one small thing, but that was from some other dollar fund we have. But that's one thing. Definitely.
Excuse me, Noreen,
Yes.
you have the exhibit E that you could pass on to your board, or if you don't, I'll be sure to send that to you because that's short and it's a good overview of what the funds can be spent for.
Okay, can you just remind me, was that part of that total update package you sent on the?
Yeah, it's been like a month or two ago, so I'll send that out to you again and I'll CC you and Kat and you can distribute it around. That's a good way to get a written overview of what it can be spent on.
That would be great. Thank you, Athena.
And Megan, since we were asked directly on ideas, do you have any, with the nurses and you discussed?
I think really going into schools is going to be my, like, that's going to be my push in Greenfield anyway. Because, you know, when I was a kid, we used to have the DARE program. And I just think with how busy parents are, they don't always have time to talk to their kids about this type of thing.
Right.
I know right now I'm putting out a program on vaping because I was just told by one of the high schoolers that 3 out of 4 of the 11th and 12th graders are vaping. And it's just unbelievable numbers that we're hearing. So I think really starting young, like, you know, 3rd, 4th grade is where you really need to start.
I also, and I'm an advocate for educating elders. Elders are given multiple prescriptions, and they're taking all these different drugs for pain relief for this, and they could be contraindicated when mixed together. And sometimes they get into a problem because they get their hip done or their knee done, and now they're taking pain meds and can't get off them. It's just a different, you know, dynamic, but it's still a problem. So it's outreach to seniors or people that are, you know, taking pain meds for other reasons, and, you know, tricks and things that just educate on what to do and what help is out there to help them. It's just a lot of, and most of it is education and health promotion, and informing doctors. I mean, I know in Greenfield, all the major pharmacies have to have signatures, they have to, and they're all, it's like a whole big database that they can't give certain pain relief, pain medications to certain people that are drug seekers. So like it's very monitored. So I don't know if it's like that. Is that nationwide or is that
Yeah.
in Mass? So that's just one thing, and we could just reinforce that. And also educating doctors and healthcare providers. I mean, you know, do you really need to get, you know, codeine for tooth extraction? I mean, do you really need, you know, I mean, it's like, it's like, yes, I
I don't think so many
do.
doctors are doing that anymore because they've all been scared. You can't even get pain meds if you really need them half the
Yeah,
time.
I mean, the pendulum has swung so far
Or the other
in the
way. Yeah.
opposite direction that
Yeah.
now people are, I would argue, under medicated for pain. But this is not the
Especially if you need
same
it, yeah.
as substance use issues, you
Right,
know,
and get it on
substance
the
use
street.
disorders.
Yeah.
So is there any talk about needle exchange, safe places for injection, you know, that really address the direct need of active opiate use disordered patients?
So we have Tapestry in Greenfield where they have needle exchange programs, and teaching safe use for drugs, and making sure people are using clean products and not sharing needles, so on and so forth. If you don't have an organization like Tapestry in your area, I am sure we can definitely get agencies like that and say that there's a need, and I could advocate for that. That's not even an issue because I deal with these organizations probably on a weekly basis. And I
And
could
we
say,
can
look, I'm
certainly
gonna
do
call.
referrals. I don't think the city would be in favor of starting our own needle exchange, but there are organizations that.
Well, what I'm saying though is having Tapestry do outreach
Yeah.
there. That's what
Yeah.
I'm trying to say. We already have a needle exchange program in Greenfield.
And
It's
also,
also-
Jen, what you were saying and talking with elderly is also proper disposal, because often kids get their stuff from the elderly, the grandmothers and grandfathers and such, so that's a big issue.
I think a lot of it is just letting people know what's out there as well. You know, a town like Leverett might not get a safe space to inject, but there is a phone number that you can call before you inject, and somebody will stay on the phone with you the entire time, so that if you stop answering questions, they'll call 911 for you. So it would probably be best to do a lot of educating on those type of things that people might not know about. And, you know, a small town might not have all the resources like we have. But there's other options that will work.
Yeah, we can put together some kind of lists like that, Megan, and make that for the group.
Jen, you're muted.
Thank you, Noreen. I'm sorry. If you want me to reach out to Tapestry, on your behalf, I'd be more than happy to, saying that you're part of our collaboration and that any services or anything that they could possibly assist with, I would be more than happy to do that. I just let me know and I'll do it.
Great. I think that just about covers everything except a MathCo update. And yeah, I don't know if Jen and her team want to stay on for that or not.
I spoke to
and that's
Carolyn
very-
last night after the state meeting, so I kind of am aware of that.
Very
Tomorrow's
good.
meeting.
I'm glad to hear it. I just need to update our board then. So
Okay.
glad to hear that, Jen. I think, are there any other questions or anything else from your perspective, Greenfield's team, that we should be talking about or you want us to know about from the collaborative?
I think as working with the other 3 towns in the other grant and now having two other towns part of, working together, I think one of the things I'm very big on is having open communication and being very transparent. I think that, you, Noreen, have seen that. Kat has seen that through our communications, and you've heard from Carolyn. And I'm very big on that. And I will always tell you what I know, and if I don't know, I'll look into it. So over that, I'm very excited to work on this grant with you guys. I think it's going to be an amazing project. I think we're going to see a lot of great changes, and we have a great team. And I really thank you all for wanting to work with Greenfield.
The thank you comes from us as well. We're very happy to be part of this group. And I, for one, and I know Garrett is my backup, have totally enjoyed working with the team. And I definitely appreciate all the communication that we get and the accessibility to each and every one of you. It's been great.
It's nice that your board is so active as well.
We have a
appreciate
great
that.
board.
Yeah, seems like it. It's wonderful.
So Arlene, are you going to be at the interview tomorrow for the
I
second
will,
candidate?
I will. Do you have I think you have my email address. I haven't seen the Zoom link, but
Okay,
It's- publichealth@shutesbury.org.
all right, I'll get that right over to you.
Great.
And I think, Noreen, did I send you the email from HR about the same questions? I don't think
You did, and I can make sure Arlene is aware of that, or just the same group of questions needs to be used for both candidates, Arlene. So
Sure,
whatever
okay.
questions were asked Tuesday need to be asked on Thursday.
Got it. Mhm.
Yeah,
For
just
consistency.
yours, Arlene. You did ask a couple, so if you can
They wrote them down.
Yeah,
Yeah,
I
okay,
took some
good.
notes, so I'll go back to
Yeah.
those. Thank you. Yeah.
Okay, well, thank you very much for having us here tonight, and I look forward to working with you all.
Yeah,
Thank-
you
thank
have
you
our
for coming in.
contact information, so shoot along any questions if you have any and comments and such.
Good night,
Absolutely.
everybody.
Did Leonard just leave? No, good. I just want to say something. If he could stay on for a second, that'd be great. Thank you. Good night.
Thank you, everybody.
Good
Thank you,
night. Thank
Athena.
you.
Right, thanks.
I think I heard Kat call you Lenny, so I don't really know you, but I'm happy to get to know you, Lenny. I'm Noreen, and just so you know, Garrett and I are members of the emergency management team. So we look forward to working with you on the team once we begin meeting again. And we will share lots of communications through that mechanism as well. But I know we totally appreciate your coming tonight and learning more about what we're doing with the Public Health Collaborative Group.
No. Okay, yeah, thanks for having me.
Thanks
Oh,
for
and one
coming.
other thing, since I'm gonna get you Jen's email, are you using the same email that the previous chief used?
Yes, firedpt
Right, yes,
@shutesbury.org.
yeah.
Right, everybody who came tonight except Megan was on the group email, so everybody's email should be available.
Great, thank you, Kath.
Okay, something weird happened here. I had to switch to my phone because the computer stopped working for me. So that's why some weird thing happened. So are you ready to talk about NAFCO, Noreen?
Yes, I guess as ready as I'm ever going to be. MAFCO is meeting tomorrow, and one of the reasons it's meeting is that there was some concern voiced at its previous meeting, which took place in March, and several of the members didn't get notice of the meeting and weren't able to attend.
Can you
So
tell everyone what MAFCO stands
I
for?
certainly
There's so
can.
many acronyms. I think it's helpful to
Yes, you're
spell it
absolutely
out,
right.
but
It's the Mohawk Area Public Health Coalition, and particularly for Claudia and Lenny. What we do is emergency preparedness planning for the county. And our partner in that is the FERCOG, which is the Franklin Regional
Council of Governments.
Council of Governments.
Okay.
And I have been co-chair of this group for a long time now. I don't quite know how to progress. There have been some process issues, let's put it that way, with regard to how MAFCO has proceeded with recommending some changes to how emergency preparedness planning is carried out in the county. And the steering committee that I chair, along with Carolyn Ness from Deerfield, has some strong feelings and consternation, I'm going to say, that they have been sidelined throughout the process. And so at the meeting tomorrow, there's going to be some discussion of the process, of the operating principles that should have been followed, that the MAFCO steering committee has developed, that in the minds of many members of the steering committee have not been followed, including last month, where there was a consensus vote taken to put forth a grant for the upcoming fiscal year to the state. And in fact, the vote that was taken was not a proper or correct vote. So there will be some discussion tomorrow. We're going to see how we can move forward with this process. I think there's some differences. There are some differences between what the steering committee believes should be the forward momentum versus what FERCOG believes should be the forward momentum. And we'll try and get that straightened out as best we can tomorrow. And I will report back to you.
Speaking of names of things, what is the name of the group that Jen and Athena just came here representing? It's Valley Health something, but that last word seems to keep changing.
I think it's the collaborative, and it was supposed to be a coalition, and I think when it went into the state, the word got changed to collaborative. So I believe it's the Valley Health Collaborative.
Okay.
But yesterday, Garrett helped me. The state was referring to us as SSAs, I believe. There was another acronym. So I'm sometimes as confused as you guys are.
I think that was shared services agreement or arrangement.
Yeah, which is another name for the public health excellence grants. So yes, our specific name for our 6 towns is the Valley Health Collaborative, I believe.
Okay.
And I admit I struggle with all these, whatever you want to call them, all of the different titles.
So I got somehow bounced out of the meeting in the middle there, so I missed some of this stuff. It was my understanding that Garrett was going to talk about the opioid settlement with the select board, because we need to get their signature before the 18th. Is that something that didn't happen?
So yes, I went to the last select board meeting
Oh.
and to talk about the communication that we sent to them that addressed two items. One was the intermunicipal agreement with the Valley Health Collaborative, and the second was to get them to approve us signing on to the settlement funds. And in talking with Becky before the meeting, she had mentioned to me that there was rework being done on the intermunicipal agreement. And so she and I determined that we would go back to the select board related to that until we have actual language for that.
Yes,
So
yes,
we just
Becky
focused
and I
on-
talked about that also.
Yeah, so we just focused on item number 2, and it was surprise, it was a little bit of a contentious meeting. So there was a lot of time pressure. So I did a very brief presentation just to say, the board supports pursuing the settlement, and that we support the concept of pooling the funds with the other communities in the Valley Health Collaborative, and that we would come back to them to talk about the intermunicipal agreement, and to gain their buy-in for that.
And
so
did they vote on the opioid settlement?
yes, and they voted unanimous on that to pursue the settlement.
Very good. Now,
So-
is Becky capable now of doing the participation forms?
I believe so. So what I had conveyed to her is, so there's not posted forms. So all select boards and or town administrators received emails from the Attorney General's office with instructions on how to pursue the settlement. So we should probably follow up with Becky just to see where she is with that.
Yeah, last time I spoke with her about it, she had opened up the electronic document that she would sort of virtually sign, but she was afraid to open it up too far because she didn't yet have select board approval. But I'll follow. Well, why don't you follow up with her on that and
follow
make
up
sure
with her
that it happens
on that. And then the other piece of this that's a bit complicated is that this is probably also going to involve a town meeting vote because of the type of account that we may need to create to put the funds in, even if we're going to transfer them and pool them with Greenfield. But there's also talk that the legislature is going to amend this such that it isn't, I can't remember the name of the type of account that you have to establish. But anyway, so I'll follow up with Becky and make sure that we've pursued the applications to meet the deadline.
Right, because we may need to get an article on the warrant. And that would have to happen quickly.
A stabilization account is what may or may not be required, depending on what the legislature does.
Okay, so I think we have to have the warrant set, like, isn't it? Is it 6 weeks in advance? Does anybody know? That's the case for nominations, but I don't know about for warrant articles. But in any case, if we need a warrant article, we should get it on there quick.
I'll pose that as a question to Becky.
Okay, and I guess the person we would have to talk to about it would be Paul Lyons as the moderator about getting a warrant article, I think, but Becky will know.
Yeah.
Okay.
Kat,
Yes.
if we're finished with those things and there's no more questions on MAPCO, I was wondering if I could just talk to Claudia and just clarify a couple things with her for a second.
Sure, go ahead.
Claudia,
she's still
glad to
here.
see you at the meeting. Thank you for coming. I understand you've met Jen at another meeting or at a training.
Yes, yes.
And so any training needs that you have or that sort of thing, I'm going to assume from now on you will communicate directly with Jen about those kinds of requests. Is that the best way to work it out for you? As opposed to me forwarding things to you and then you talk to Jen? What's the best way for us to communicate effectively?
The best way would be for me to be in direct contact with Jen.
Yeah, that's
That way we're not duplicating messages.
great. That's great. That's what I hoped you would say. So
Yeah.
you're on the email list and you're getting all the notifications from her directly now.
Yes.
That's great. I just have one other thing to say. As you know, as away for a long time, and I really want to thank Garrett and Arlene for helping out with all of this stuff. There are a lot of working parts that are going on, and as usual, I feel really grateful to be a member of this board who works together and people help cover each other, and we're all trying to understand a number of different things that are going on at the same time. So I really appreciate it.
Well, I second that, Noreen. I think that we have a great board and I'm really grateful for all the work that everybody's doing.
I agree.
So are we done? Or what? We have more things to talk about?
Nothing else.
I make a motion, we adjourn.
Second. Any objections?
No.
Okay. All right. So right before we actually adjourn, Garrett's going to follow up with Becky about making sure we get on the opioid settlement, and Noreen's got projects, and Arlene is going to work on the nursing interview, and I guess I'll just take some time off. I wish. Is there anything that I've left out that's important that we just need to keep track of?
No, just that I need to get back to you next time we meet about what happens on the MAFCO meeting too, Kat. So
Right. I'm looking forward to hearing that.
And thank you to Lenny for coming to the meeting.
yes, definitely.
Yes, for sure.
Yes.
Kristen was going to come, but apparently she got into some other thing and was unable to come. So shall we call it a night?
Definitely.
Sure. So somehow I was the one who had to admit you back into the meeting, Kat. I don't know how I ended up being what seems like, am I supposed to stop a recording?
Yeah, I guess you better, because
All right.
because I don't think I can, because I
Okay.
got bounced. Something happened with this computer and I got
Yeah.
bounced, and so it just automatically made you host.
Yeah. Okay. So I'm stopping the recording now.
And make
Okay.
sure to select to the cloud
I
instead of
see.
to your computer.
Stop